Thank you for choosing me and my team for your hip replacement surgery at either Franciscan Hospital or OrthoIndy Surgical Center. This video is intended to answer common questions and set appropriate expectations before and after surgery, as well as information about the surgery itself. Please note that individual risk and outcomes do vary, so this guide is intended to set the average range of expectations, but please be aware that variations are always possible. Usually the first series of questions is regarding the hospital stay, recovery time frame, and aftercare for planning purposes. The surgery itself is typically outpatient, which means that you arrive and discharge home the same day. You will receive physical therapy and recovery, where you will be given guidance on navigating the steps, utilizing a walker, among other activities. Some patients will stay overnight, either for medical monitoring or for rehab purposes. To go home the same or next day, we recommend a spouse, friend, or family stay with you 24/7 for at least 3 days minimum, and preferably 1 to 2 weeks, depending on your baseline functional status and your anticipated needs. We also recommend bathroom and bedroom located on the main floor to avoid stairs the first 2 weeks, although using stairs is possible if you have good railing and assistance. Note that inpatient rehab or skilled nursing at a nursing home is an option facilitated by the case management team at Franciscan Hospital after surgery, and this is the exception offered to individuals who live alone or have assistance needs due to advanced age or medical comorbidities. In addition, home health care, physical therapy can be arranged for a therapist to come out twice a week for the first 2 weeks, and is facilitated after surgery by the Franciscan case management team for those who either have difficulty getting rides or live a long distance away from physical therapy. On average, initial recovery is the first 2 weeks where you will be utilizing a walker, avoid driving, and you'll be taking pain medication as needed. Most people transition to a cane at 2 weeks and are 90% recovered in approximately 2 months. A small percentage of patients may still experience lateral thigh numbness or burning, muscle spasms or soreness, and bursitis, which can be managed with injections, continued physical therapy, and usually improves over time. Physical therapy is prescribed one time prior to surgery for pre-op exercises and once weekly for 6 weeks post-op by default. Return to work in 3 weeks is usually recommended for an office job, 6 weeks for medium activity job, and 3 months for highly physical occupations such as working in maintenance or in construction. Typically, we prescribe pain medication, anti-inflammatory, muscle relaxer, aspirin, stool softener, and in some cases an antibiotic to manage your pain and risk factors with surgery for the first 30 days. Icing for 20 minutes every several hours the first 1 to 2 weeks is very helpful. I recommend to place a cloth or other material between the ice and the skin over your hip to avoid ice burn. Some people choose to purchase or rent an ice pack sleeve or cooling machine, and Amazon is a great option to provide resources in this regard. You can shower with the surgical dressing immediately after surgery, which will stay on for the first 2 weeks, and continue showering but no soaking or submersion for 6 weeks after surgery to avoid risk of infection. Now that we've covered the most pertinent questions for planning and mental preparation for surgery, let's cover the procedure itself, risk, and benefits. A total hip replacement involves replacing both the ball and socket with metal components, primarily a titanium alloy, and also a polyethylene liner, as indicated in this model here. There's a ceramic ball that articulates with a polyethylene liner and is your new bearing surface. Although several surgical approaches can be utilized by a surgeon for hip replacement, I utilize the muscle-sparing anterior approach because it offers the quickest recovery, least pain, and least anxiety over dislocation compared to other approaches on average. These benefits are the expected result of utilizing the natural interval between muscles and nerves to facilitate replacement instead of cutting through the muscle, which must be done through all other standard approaches. I also utilize technology such as X-ray and Mako robotics to confirm precise alignment, stability, and equal leg lengths, which is important in terms of outcomes prior to placing the implants. Risk of surgery include infection, bleeding, blood clots, of course scar and stiffness, swelling, leg length discrepancy, fracture, implant loosening or failure, dislocation, numbness, and nerve pain on the lateral thigh or nerve injury, and in exceedingly rare cases, loss of life from heart or blood clot complications. A few details to be aware of in planning for your surgery would be to avoid dental work for at least 3 weeks prior to or 3 months after your surgery. We recommend to take care of any outstanding dental problems prior to your surgery. When you return to your dentist postoperatively, please have them prescribe amoxicillin 2 grams or clindamycin 300 milligrams and take 1 hour prior to cleanings or procedures for the first year after your surgery to prevent joint infection. If you have immune compromise or significant medical problems such as diabetes, you may choose to pre-medicate with antibiotics for the rest of your life when you get into work done. You will get pre-testing labs, usually through the clinic, prior to surgery to screen for medical problems affecting surgery or anesthesia. If you see a heart doctor, please let us know and we can facilitate a cardiac clearance prior to surgery for anesthesia purposes. Surgery staff will typically have you washed with chlorhexidine the morning of and potentially the night before surgery to reduce skin bacteria and lower the risk of infection. Nutrition is also a very important consideration after surgery to give your body the optimal tools to support immune health as well as wound healing. I recommend that you drink plenty of fluids, utilizing coconut water and even prune juice after surgery, and also maintain plenty of fresh protein from sources such as eggs, lean meats, fish, tofu, nuts, seeds, beans, and dairy. To avoid constipation, also stay hydrated, drinking plenty of prune juice and coconut water. And if you haven't had a bowel movement in at least 2 or 3 days after surgery, or at least past gas, consider using over-the-counter milk of magnesia or other products that your local pharmacy can provide to get your bowels moving. Pain is quite variable through the time frame of recovery and from person to person. Although we provide a variety of medications to help with the pain, you may still have pain afterwards, and our goal is to simply take the edge off to make it tolerable. There are no specific restrictions after your surgery other than avoid long-distance running or impact. Just common sense and avoid extreme rotation of the hip on purpose for the first 3 months. Progress activities gradually is tolerated. Long-term, most patients can return not only to normal daily activities, but even recreational sports within moderation. For example, running for several miles a day up to several times a week is permissible, but I encourage low-impact exercises like cycling as much as possible. Thank you very much for your time and attention in watching this video, and we wish you the best in your success and recovery from your hip replacement surgery.